Hello, my name is Dr. Sonal Asthana. I'm the lead consultant for hepatobiliary surgery and liver transplantation at Aster Integrated Liver Care, Aster Hospitals, Bangalore. I'd like to talk to you today about the link between metabolic liver disease or fatty liver disease and gut inflammation. As you know, fatty liver disease is the new epidemic that the world is grappling, especially so in India. India is the diabetes capital of the world. Almost 20% of Indians have some degree of diabetes or are predisposed to diabetes in some way. This is now understood to be part of a larger spectrum of disease called metabolic disease, metabolic syndrome, which is associated with gut inflammation, fatty liver, high cholesterol, and predisposes one to cardiac disease as well. Diabetes, of course, is also an important risk factor here. There are many factors that predispose Indians specifically to metabolic syndrome, that those are related to our genetics, our diet, and so on and so forth. The topic we're interested in today is gut inflammation. This basically comes down to a more recent understanding of ours that we are populated by a large proportion of bacteria in our gut. In fact, some would go as far as to say that the number of bacteria are larger than the number of cells in our body. These bacteria are generally friendly. They have evolved to be with us for millions of years and play an important role in digesting as well as detoxification of the foods that we normally eat. Owing to a change in our dietary patterns, more refined food, more sugars, etc. being consumed, more alcohol being consumed, now the dietary pattern has actually changed the flora of our gut. And the friendly bacteria have been replaced by different kinds of bacteria which are predisposed to inflammation. These can affect the digestion of certain foods and lipids, as well as promote pro-inflammatory changes in the liver, which can change fatty liver to steatohepatitis. And in the long run, this can cause cirrhosis and liver failure. So certainly, there are steps that one can take in order to change or modify the gut flora in order to prevent gut inflammation from affecting the liver. Predominantly, firstly, is to watch what we eat. Avoid refined food, avoid ultra-processed food, avoid simple carbohydrates, sugar, and rice. Any complex carbohydrates such as millets, ragi, etc. are easier for the bowel because they release sugar in a slower fashion, which is easier for the bowel to maintain. The second is using natural probiotics. For example, yogurt is something that can be consumed. Yogurt is really good and it contains a lot of friendly bacteria that are useful for the system in the long run. Using dried fruits, etc., which are very nutrient dense and also help in maintaining the gut bacterial composition is actually helpful. The other big neglected part is exercise, making sure that getting some activity in. These are obviously general things that will also improve the metabolism and probably reduce the risk of fatty liver disease. So take care of your gut, take care of your health, watch what you eat, and make sure you get those 4,000 steps in. Of course, we certainly hope that you can take care of your liver, but should you require any treatment for your liver disease, right from simple liver ailments to complex diseases, including liver transplantation, Aster Integrated Liver Care is the largest provider of liver care in Karnataka. We run an integrated liver care service and provide the entire spectrum of liver care, including medical care, surgical care, interventional radiology, and endoscopy that is available in the state of Karnataka.